Welcome dear friend dog lover. Thank you in advance for visiting my channel dedicated to the happiness and health of dogs. Today we are going to deal with a very important issue, and it is pancreatitis in dogs. Pancreatitis in dogs: symptoms, causes and treatment. Pancreatitis in dogs is one of those conditions that owners must be informed about before it strikes, because the warning signs may not always be obvious at first. The symptoms might be mistaken for something less serious, and yet it's potentially life-threatening. The medical definition of pancreatitis is simple: inflammation of the pancreas. But like all serious conditions, there is more to it than that. Because it is dangerous, a suspected case of pancreatitis needs to be addressed by a veterinarian as quickly as possible and not dealt with by DIY treatments. As with all medical issues, even the best online resource is not a replacement for medical guidance from your vet. Before looking at the details of pancreatitis, let's take away the "itis" and explain the small but vital organ itself. The pancreas is responsible for releasing enzymes that aid in digestion. When the organ is working normally, the enzymes become active only when they reach the small intestine. In a dog with pancreatitis, however, the enzymes activate when they're released, inflaming and causing damage to the pancreas and its surrounding tissue and other organs. According to the Whole Dog Journal, the enzymes can actually begin to digest the pancreas itself, which causes extreme pain to your dog. Classic signs of pancreatitis in dogs: hunched back, repeated vomiting, pain or distension of the abdomen, dog appears uncomfortable or bloated, diarrhea, loss of appetite, dehydration, weakness, lethargy, fever. If your dog exhibits one of these signs, and only infrequently, monitor her. But if she exhibits multiple signs at once, and repeatedly, a call to the veterinarian quickly is vital. Causes of pancreatitis in dogs. There are a number of causes and risk factors that can bring on pancreatitis, though often the attack appears seemingly out of the blue. Among them are a high-fat diet. This is a major cause of pancreatitis, especially for a dog who gets one large helping of fatty food in one sitting. A history of dietary indiscretion, a medical term for saying your dog will basically eat anything. Obesity, hypothyroidism or other endocrine diseases, severe blunt trauma, diabetes mellitus, certain medications or other toxins. These include cholinesterase inhibitors, calcium, potassium bromide, phenobarbital, L-asparaginase, estrogen, salicylates, azathioprine, thiazide diuretics, and vinca alkaloids. There may, in some cases, be a genetic predisposition. More about those fats. Human food is especially dangerous, though even high-fat dog food may cause pancreatitis. So owner vigilance is particularly required around holidays and other festive occasions. They can bring well-meaning guests who slip your buddy a fatty piece of lamb, or a tray of buttery cookies left within reach of an eager muzzle. In fact, the day after Thanksgiving is known for more than just Black Friday bargains. It's one of the busiest days of the year. Pancreatitis-related emergency vet visits. Basically, if your dog is showing any signs of abdominal pain, the worst thing to do is feed him a fatty diet. This is one of many reasons that giving your dog table scraps, as tempting as it may be, is not advisable. How does a vet diagnose pancreatitis in dogs? Your dog's medical history. Blood tests to measure pancreatic enzymes. Physical examination including stomach, gums, heart, temperature. Radiographs or ultrasound, to rule out other causes. Fine needle aspiration of the pancreas. As the Merck Veterinary Manual notes, as with any disease, no test should be used in isolation for diagnosis, and all clinical findings should be used in conjunction to arrive at the most appropriate diagnosis. What's the difference between acute and chronic pancreatitis? Acute pancreatitis. An acute attack of pancreatitis means it comes on suddenly, with no previous appearance of the condition before. It can become life-threatening to other organs if the inflammation spreads. Chronic pancreatitis. A chronic condition is one that has developed over time, slowly, and often without symptoms. This condition can result from repeated bouts of acute pancreatitis. Both acute and chronic forms can be either severe or mild, and both result in pain. Treatment and management of pancreatitis in dogs. There's no fancy treatment for acute pancreatitis. First and foremost, your dog's pain must be managed, and early intervention to prevent further complications is key. The most common treatment and management options are intravenous IV fluid therapy in severe pancreatitis, vigorous monitoring of a worsening condition, antiemetic medication for vomiting to prevent dehydration, resting the pancreas, withholding food and water for 24 hours. Long-term management includes vigilant monitoring of fat intake, no table scraps allowed. Use of a prescription diet of gastrointestinal supportive low-fat, or ultra-low-fat, food. Feed smaller, more frequent meals instead of one larger meal. Have amylase and lipase levels checked by a veterinarian regularly. Can supplements be used to prevent or manage pancreatitis in dogs? It is important to reiterate that pancreatitis is a serious condition, so home remedies shouldn't be used in place of veterinary intervention. That said, some vets believe digestive enzyme supplements with pancreatin can help some, not all, dogs by reducing the work of the pancreas and inhibiting pancreatic secretion. These come in over-the-counter strength as well as prescription strength. Fish oil may seem counterintuitive at first, because of its high fat content, but it can actually help lower blood lipid levels. Studies suggest a high level of fish oil, about 1,000 mg per 10 pounds of body weight for the dog with high lipid levels, about half that amount for dogs with normal levels, is helpful to dogs with acute pancreatitis. When supplementing with fish oil, also supplement with 5 to 10 IU of vitamin E. There have been human studies suggesting that vitamin E, with selenium, vitamin C, beta-carotene, and methionine may help prevent pancreatitis. Conversely, another human study reveals that probiotics can make acute pancreatitis worse. Always speak with your veterinarian before offering any supplements to your pet. You're a wonderful person. Wow, you came to the end of this video. Can you please subscribe and activate the bell? If possible, we would appreciate you giving us a like. We appreciate it from the heart. Thank you very much and God bless you.